was in 2008. I'm at a business meeting in Denver. Get back to the hotel, and I fall to the ground with a grand mal seizure and woke up in the hospital in Denver to a guy in a white robe over me saying, "I'm sorry to inform you, sir, you have a brain tumor." So I go back to Des Moines and had a full craniotomy, 65 staples in my head. And I woke up to the doctor saying, I'm sorry, there's too many fingers, it's too deep. It just can't be removed. I would have killed you right on the table. We'll get you started on some radiation and chemo. And I said, yeah, and then I'll be okay? He said, well, Mrs. Robinson, you might want to sit down because no, radiation and chemo will just buy you a little time. You might have a year, but most likely you've got 6 months. As I'm getting fitted for a radiation mask, my wife stood up in that room and said, take that off of him. This can't be our story. Help us get to Duke.
The mission of the Preston Robert Tisch Brain Tumor Center at Duke University is to cure brain and spinal tumors. This one-of-a-kind institution provides the resources and support necessary for patients and their families to meet the challenges of living with a brain tumor.
But I didn't go on any radiation and any chemo, and I'm now an 8-year survivor.
Tate was probably 6 months old, and he just wasn't at the stage of most babies. Right about when he was 17 months old, 18 months old, he was so sick. Right before Christmas, we got up to start the day, and I stood him up beside the bed, and he just fell over. We're sitting there with him in the doctor's office, and she does a couple of tests, and trying to get through this without crying. She said he could have a brain tumor. She said, you need to pack up, go home, pack him up, and go to Duke. They went and did a CT scan on him, and we get back to the waiting area. It was a crazy night, and the neurologist on call came in and told us that they had found a low-grade mass in his brain. For basically 12 hours of my life, it was hell. Not knowing, what it was, would it be curable, would he be okay? December 19th was when we were diagnosed, and he had surgery on December 21st. Surgery was great, no issues. It was the size of a billiard ball in his cerebellum, which is the lower part, which is what affects your walking, your physical abilities. He didn't have to do chemotherapy or radiation, so we just go back. We went back every 3 months for 6 months, and then as we've grown, we've gotten longer MRIs. So far, so good. Everything's great, but I can't say enough for the staff, the Brain Tumor Center, the surgeons, the nurses. They were wonderful, really wonderful.
When you give to the Brain Tumor Center at Duke, you're not giving to an organization. There is no money going to an organization. 100% of what you give goes directly to the doctors and scientists, and that money is directed by the medical staff at Duke, no one else. You may know someone already that has formed a team and is raising money to fight brain cancer, and you can just go to the website, find your team, and make a donation to that team. But what we'd really like you to do is to form your own team and go into your community and your circles and raise money to help us fight this deadly disease. We know there's angels among us watching this video, and we ask you to step up and be an angel today for someone that really needs your help.
Visit angelsamongus.org or call 919-684-4784 to find out how to support the life-saving and life-improving work of the Preston Robert Tisch Brain Tumor Center at Duke.